Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah ar-Rahman ar-Rahim. Today we will discuss the case of breaking bad news, and it is the second most common case, most common scenario that present in station 4. Breaking bad news actually have a lot of ways to discuss this bad news with different approaches that present on the books to discuss the bad news with the patient. The last one and the most common one is giving patient warning shot before discuss the bad news directly with the patient. As we said, this is the second most common scenario with or without counseling. The counseling itself might be about chronic, non-curable, irreversible disease like dementia or Huntington disease, like multiple sclerosis, like Parkinsonism, or like myotonic dystrophy. It might be discussion of end-stage cancer with need palliative treatment or brain stem death. It might be about brain stem death with organ donation. So when to start breaking the news for the patient, you have to apply what we learned in the last lectures. Introduce yourself first and confirm the patient and take a consent from him. Hello, I am Dr. Ali. I am here today to discuss your health condition. May I confirm you are Mr. Salah, 36 years old? Yes, I am, doctor. Is that okay to discuss your health condition with you? Is it okay to discuss your father's health condition with you? Are you the next kin for your father? Do you want anyone to attend this meeting with us? No, doctor. Why you want someone to attend this meeting with us? Just to support you while we discussing the matter of your health. No need, doctor. I'm okay. Okay, may I ask you, how do you feel right now? I'm good, doctor. I'm fine. There's no problem with me, actually. So may I ask you about your expectation? Do you have an expectation about the problems that you have, or the medical issue that you have, or the medical health problems or the health problem that you have? Or did anyone of the medical staff discuss your health condition with you? No, doctor. Then just take a breath and give him the warning shot. Okay, Mr. Salah, I'm really sorry to tell you that the investigations results came back, and unfortunately it's not good as we hoped. And then take 5 to 6 seconds silent. For you, just give the patient silent second to absorb the warning shot and to absorb the bad news after you will tell it. Now the patient after that will ask you, what do you mean, doctor, by bad news? You have to directly answer this question that you have a disease called multiple sclerosis. You have a disease called multiple sclerosis. Have you ever heard about it? No, doctor, it's for the first time to hear about multiple sclerosis. Is it cancer, doctor? No, it's not cancer. I may tell you and explain more about the disease if you want me to do so. Please, doctor, explain. Just take consent from the patient if he wants you to explain more about the disease itself or not. And try to keep eye contact as much as you can and try to practice it daily. Then in counseling about any disease, in breaking bad news or any other disease, you have to define the disease at first. Like if you will discuss Parkinson's disease, actually Mr. Salah, you have a disease called Parkinson's disease, and this is disease occurring due to a problem in the chemical messengers in the brain, causing this abnormal movement in your hands, and it occurs mainly in the nerves inside your brain. So you define the disease now, and it's controllable with medication, but unfortunately it's not curable. Then you discuss the pathophysiology with the patient. Then tell him about the clinical picture of the disease itself, the symptoms and the sign of the disease. It came about multiple sclerosis, to discuss different scenarios about multiple sclerosis. It came with loss of movement, transient transient loss of movement of one of your hands, or both of your hands, or both of your legs. It may came with a problem in our blaring in your vision. It might came with loss of movement, total movement in your both of your legs. And then tell the patient about the complication. Are you following me first? The complication of the disease itself, myotonia dystrophia, is catastrophic. I'm really sorry to tell you that it's incurable, debilitating disease. You may need, or your father may need help in his way to digest his food. We may need to put a tube for him. It might cause affection of his lungs or his respiration, and he might need also a help in that. Then take the history part, which will be remarked for in this scenario. Ask him about his social activity, or his father's social activity, with whom he is living with, and if they are okay or not. Ask him about his job, and if he has any bad impact on his job or not. Ask him about smoking, and if the smoking itself is generally bad for your health, and especially in your disease, it might be not good and not helpful. Ask him about alcohol, if he drink more alcohol. Ask him about driving, and if he has any bad impact of driving. About the past medical history, you may ask the patient about if he has any long-standing disease or taking any medication for any disease, and if he has any drug list or medication list. At this point, go to the second part, to be remarked for the concern. When the patient, the examiner tell you say 2 minutes remaining, clearly ask the patient, may I ask you what is your concern, and answer it directly. Do not hesitate, do not wait, do not ask the patient another question after that until you respond and tell him and explain for him the answer for his concern. Then the clinical judgment part, tell him about the management plan, your management plan. You will admit him in hospital or not, the investigation you will do for him, the blood investigation you will do for him, any scanning for his brain or for his backbone, or any need for biopsy or surgery. The treatment itself, about the multidisciplinary team, which would include the doctor of nervous system, or the consultant, our consultant of nervous system, and specialized nurse like Macmillan nurse in case of cancer, or in case of debilitating long-standing disease, and also social worker to help him, and occupational therapist if needed, smoking cessation clinic if needed, alcohol group therapy if needed. After that, you have to recap your patient just by asking him direct question. May I ask you, what did you understand from our discussion today? Or I'm really sorry, in case of breaking bad news, I'm really sorry to be the one who gave you this news, but may you please recap me, tell me what did you get from our discussion. Then finalize your case, ask about any other concern. The patient may have 2 or 3 concerns. Try to answer all of them. You have to answer all of them actually to get all the mark. Clearly, without lying, without hiding any information to the patient. Do not hide any information. And if you don't have the knowledge of the disease or the knowledge of the medical issue about the patient, just tell him, I will go back, I don't have this piece of information right now, but I may go back to my consultant and will back to you with this piece of information in the next appointment. Then give the patient your hospital contact number if he wanted to ask you about any question about his health condition. He may call you. Any leaflets and websites to tell him more about his disease, and brochure to tell him more about the disease. Then thank the patient and close the case. Breaking bad news is one of the second is the second most common case nowadays in station 4. You have to practice it, to take the time or the silence seconds between every warning shot, or between the warning shot and telling the patient or breaking the bad news to the patient. Try to practice it, because it will take, you have to finish your 14 minutes with the patient before finalize your case. That's for all today, and thank you. Wassalamu alaikum wa rahmatullahi wa barakatuh.